Wouldn't it be great to have fresh, new patient leads in your inbox every morning and start your day with a funnel that creates results? Funnel marketing for the private practice is an extremely powerful tool. We've seen it implemented, and we have implemented it multiple times, and it radically transforms the way you look at your lead generation. What it does is create new, meaningful, quality leads, so patients who are ready to take that first consultation and to choose you as their specialist surgeon or specialist doctor or clinic. So let's zoom out a little bit. What we're doing here with a funnel is it's not aggressive marketing, it's gentle guidance. That's how I like to call it, gentle guidance to take the patient by the hand as they're browsing information on your website and show them a palatable next step. This is not like, hey, I'm on this website and I'll click here and have a knee replacement. That's not what we're talking about. We're talking about an acceptable next step. Acceptable next steps for weight loss surgery could be check if you're a candidate. An acceptable next step in a funnel for an obstetrician could be take the test and see for a good match. You've got your preferences in regards to giving birth. Let's do the test. So the next step should be easy for the patient to engage in. Now, there is this theory and this marketing concept that you may have heard of, and it's about the rule of 7 or the 7 touch points of marketing. What that means is we don't get obsessed by the number 7. It's this rule that says the more we can build in multiple touch points, the higher the likelihood that there's going to be a positive buyer's decision or a decision to buy. And that is very valid in the field of private healthcare, because remember, this is all about building trust. You want enough rapport and trust so the patient chooses you, not your competitor. And the way to get there is to multiply the amount of conversations or the amount of touch points, to use that very technical marketing term. So a funnel mainly serves that one purpose. It's get away from the passive reading of content on your website and move it to the next step, which is a conversation. Could be a phone call, could be an email conversation. That is up to you to set up that system. And that's, of course, another important aspect. It's systemized, it's semi-automated. It has to be systemized and semi-automated. And of course, you want to make sure that there is quality follow-up on the other side, on your side, that you have a high-performing reception team or practice management team that's able to actually call the patient and say, hey, we've seen your form. Thank you for contacting us. I see you're exploring XYZ. Let's take the next step, which could be, I can book you in for a consultation, or let's go over a few things over the phone. So you can look at this as a semi-automated way to bring in extra patient leads, quality leads. These are patients and consumers who are willing to take that next step, which is click on that button, enter a few details. So if you're interested in applying this for your practice and in really enjoying that systemized growth, book the free Zoom call and we'll explore the growth of your private practice.